Hi there, my name is Anna Dolopo. I'm a licensed acupuncturist, and you can find me at elementsinharmonyacupuncture.com. The office number is 949-305-1703, and my cell phone that you can text anytime is 619-341-4341. This is my 23rd year in practice, and I practice in beautiful Laguna Hills in Orange County, California. And today I'm just going to make a short and sweet video to explain some of the issues that I was able to treat in a woman who is a mother of three. We'll call her M, and she came in with some long haul issues from having been infected a few months ago, and she just wasn't able to shake off these symptoms that she had been feeling, and she just wasn't feeling healthy. So the issues were wanting her nervous system to feel calm. She felt pretty anxious and stressed out due to the viral infection. She felt tremendous bloating, digestive issues. Her immune system did not feel back to normal, and she just wanted to feel happy again. She didn't want any more digestive issues. She didn't want any more bloating. She didn't want any more anxiety. Those were the top ones. Those were the top symptoms. So I just want to tell you what dates she came in. She came in 6 times beginning. I hadn't seen her since October 2020. So she was fine. She's the kind of, we've worked together for years, but when I don't see her, no news is good news. So I didn't see her until almost a year and a month later, November 19, November 23, November 24, November 27, December 11, December 13. Fixed the issue in 6 treatments. No more bloating, no more anxiety, no more stress from that situation, but it was a lot of anxiety, a lot of nervousness, and her digestive and bloating issues were just not something that she felt very comfortable with. And I'm very happy to say that I saw her last week at the gym, where we belong to the same gym. I saw her and I said, wow, you look amazing. And she had been texting me since December 13th, since I had last seen her. And she said, I feel awesome. And when I saw her in the gym last week, I said, you look really healthy. And she said, I feel healthy. She looks healthy. So I just wanted to shout out that little experience that we've had. Someone came in yesterday. He had the infection a couple of weeks ago, and he had, or several weeks ago, and he has had anxiety since then. So that is what I'm treating. And so we'll see what the results will be. I'm treating a lot of those, post the infection, and then they come in. I'm calling it the infection, okay? So you can interpret that however you want. And so usually I can fix the issues between 1 to 15 treatments, at least by 80, maybe to 100% of residual issues. And also, someone else had, been people who come in with loss of smell, stuff like that. I'm going to leave out here any other questions you may have. I just want to stick to the symptoms and what acupuncture has been able to do. So far, I've been able to treat these issues extremely well with the Just Balance Method acupuncture. If necessary, I'll do herbs. I hope that this reaches some of you to understand that if you've... Oh, and someone else came the other night. She's had tremendous brain fog since she was infected. And these are people who've been vaccinated and also people who've not been vaccinated. So, and again, these are people who are coming weeks after their infection. So they're no longer, contagious. But it's great to see that they are feeling much better, and they feel like their lives are back, their energy is back, they can smell again, they can eat again, they can sleep again comfortably, they feel happy, they're not feeling fatigued, and they feel like they can breathe, and they just have their lives back. So if you know of anyone who may have been infected in the past and they're still not feeling 100%, they want more energy, they want their appetite back, they don't want to feel nauseous, they don't want to feel anxiety, they don't want to feel whatever, acupuncture. And there's a lot more research coming out and I'll post those on social media every time I find something. I will post it. I will lead you right now to my website, elementsinharmonyacupuncture.com, and if you go to slash qigong dash research, I did a very long I did a video on, this was a doctorate program video, Qigong, COVID-19 and its health impact on overweight patients. But the thing that I want to lead you to is a study that was done on PubMed. This particular article can be found at pubmed.ncbi.nlm.nih.gov/324-25471. And this is regarding Qigong and COVID-19. I've been teaching Qigong since 2020. Specifically, I had already been doing it, but especially I was doing it then on Facebook Live. They're on my website because here in California, a lot of the beaches were closed for a while. So I was just teaching here so I can get my patients still moving, because sitting down, doing nothing is not the healthiest thing to do. So I'll just read the abstract. The elderly are at high risk of contracting respiratory infectious diseases, including COVID-19 infection. The recent pandemic has the potential to cause significant physical and mental damage in older adults. Similarly to other mind-body exercises in traditional Chinese medicine, Qigong features regulation of breath, rhythm and pattern, body movement, and posture and meditation. Given these traits, Qigong has the potential to play a role in the prevention, treatment, and rehabilitation of respiratory infections, such as COVID-19. Potential mechanisms of action include stress reduction, emotion regulation, strengthening of respiratory muscles, reduction of inflammation, and enhanced immune system. 3 forms of Qigong, abdominal breathing, Baduandin, and Lu Zi Jui, all of which are gentle, smooth, and simple for the elderly to practice, are recommended in this context. The keywords are COVID-19, Qigong, older adults, respiratory infections, and copyright 2020, American Association for Geriatric Psychiatry, published by Elsevier, Incorporated, all rights reserved, and the DOI is there. So you can find what I quoted them at elementsinharmonyacupuncture.com/qigong-research. I've been a practitioner of Chinese medicine since 1999. I'm in my doctorate program right now, my 23rd year in practice. I'll be done this year. And so I'm very much in research mode right now. And I'm finding studies of acupuncture and Chinese herbs. And this one I'm sharing. And I feel it's time for people to understand the level of work that I'm doing here. And so it is important to understand that if you're vaccinated and you have symptoms and you're having these long haul residual symptoms that you just don't know what to do, acupuncture, Chinese herbs are a powerful method to help you heal from those infection issues. If you're not vaccinated and that's not something that you want to pursue for whatever reasons, I judge no one. Whether you're vaccinated or not, I judge no one. I'm here to treat you. People come weeks after their infection, and I'm seeing issues of anxiety, loss of smell, nausea, and sore throat, and other issues. Like they just can't shake it. Pre-COVID, pre-2020, from 1999 until 2019, I expected every September, maybe even August to March, for people to come in with cold and flu symptoms. And I was able to treat them very well with Chinese herbs and acupuncture. So this is a touchy subject for many people when it comes to this particular issue going on the planet. But I am a leading expert in at least in my world when it comes to healing people, and it is my responsibility to let people know what exactly I'm doing. I can help you with whatever issues you have, and at least by 50 to 80%. So if you're tired, I'm seeing people, someone came in yesterday and he's a vice president of a large banking company, a company that you would know. It's everywhere. And he's taken about a month off from, or at least a few weeks off, and he's going to take a little more time off, so maybe around a month or so. And he's not checking emails. He's done for a little bit, because the mental health issue that started this day he was infected is beyond something he can handle. And when men come here for mental health issues like anxiety, that is not something that men easily open up about. And no matter what anyone tells him, because people are saying, no, it's not related to that, he knows in his heart it is. And he felt relieved to know that I treat people who have had anxiety the moment they were infected. So, take it for what it is. I don't care about this cancel culture. I don't care about any of that. I am a practitioner of Chinese medicine, and I'm soon to be a doctor of acupuncture and Chinese medicine. It is my responsibility to tell the world exactly what I see. I've always been very transparent, and I'm not going to stop doing that now. So, if you know of anyone who's had this issue, and they're past their contagious phase, and they would like to come get some healing, my doors are open. They can go to elementsinharmonyacupuncture.com. Thank you.